Across the network, all of our facilities have care coordinator teams. They do outreach. We have a tremendous collection of folks that are out constantly doing outreach. I think that has helped us, in addition to, as I mentioned earlier, that we continue to develop new streams of workload and get new folks signed up for VA services. And this team is also responsible for tracking every new OIF, OEF veteran entering care and ensuring that all services the veterans need are provided as necessary. It was mentioned that about the screening process to TBI, every veteran seeking VA care at any facility is given a physical by a primary care team, which includes a screening for exposure to TBI events and symptoms of PTS, depression, substance abuse, and thoughts of self-harm or suicide. The same screening for these conditions is repeated on an annual basis for new or existing veterans of any service area. Should a veteran screen positive for any of these conditions, further evaluation and appropriate treatment is provided. In fiscal year 12, we provided PTS outpatient services to 8,650 veterans. Each facility has a PTS clinical team, a group of clinicians trained and skilled in monitoring research-based intervention techniques to help veterans with combat PTS. Just mentioned briefly in the area of polytrauma and traumatic brain injury, our Cleveland VA is one of 22 national polytrauma network sites and a major resource for polytrauma services in VISN 10. And polytrauma network sites develop and support a patient's rehabilitation plan through comprehensive interdisciplinary specialized teams, provide both inpatient and outpatient care, and coordinate services for veterans with TBI and polytrauma throughout the VISN. And additionally, I think last year which we don't talk about much, but in these settings, but I do think it's worth mentioning that we also have established a very comprehensive national VA caregiver support program. And that came into law, I guess, about a year or so ago that we ramped up on that. And it was Public Law 111-163, and it provides direct benefits to family caregivers by establishing a comprehensive national caregiver support program and prevention and wellness focus that includes the use of evidence-based training and support services. And it has limited eligibility. We've actually now grown to 123 individuals that are qualified for that and enrolled in that caregiver support program, and which is really a big increase over what we originally projected at the very beginning. We work closely with VA and DoD, shared long-standing integrated collaboration in the area of TBI, and work through the Defense and Veterans Brain Injury Center. And in Cincinnati, it's very much worth mentioning because we're very, very proud of it, and is that we have a nationally recognized residential treatment center that works with veterans who have been diagnosed with concurrent TBI and PTS problems. And these programs are comprised of 2 intensive 7-week programs for men and women veterans and an intensive 8-week program for veterans for both PTS and traumatic brain injury. Each program provides assessment and brief treatment for PTS. During their first week in the program, patients receive a multidisciplinary assessment to evaluate their readiness for the program. And I think Dr. Kate Chard is our director of that program, and if you Google her, you'll see that she's been a speaker at many national events, is constantly being sought out by national media sources to talk about this program. And while we focus on veterans from Ohio, we do provide services to veterans from other networks that may not be able to have their needs met elsewhere, and based on our availability of slots. The program is constantly full, and probably we could even expand it further in the future. So VISN 10, I think, has also really been very proactive in homeless veteran identification. I mean, this is a regular topic. In my office and with my leadership teams, we talk about the homeless programs every week at least on my calls with the directors and also within our own structure. Jim is going to, will brief you on everything that's going on there. But we've been involved with a number of programs and pilots to help roll this out. We're now tracking homeless through the homeless registry documentation system. That is, I believe, that program was an outgrowth of one of our briefings with the secretary. I remember him asking me once, how do we know where all the homeless veterans are? And that was a good question. I mean, everybody knows a little bit, but nobody knows where everything is. So I think out of that, that question probably got asked to other network directors in their briefings, and out of that came this registry. And just a minute on HUD-VASH vouchers. Since HUD has allocated about 47,000 of these housing choice vouchers across the country, and as of now, we have working relationships with 15 different public housing authorities, and we've allocated 1,125 of these HUD-VASH vouchers. So we're really making progress. I think we are in line to get some new ones in the very near future. We're just waiting on the allocation and how we will and where those will come. There are different criteria that go into how those vouchers are issued, and then once we get it, but we're gearing up. We're already in the process of anticipating where we think they may go and getting our staffing in place, because with that comes a requirement of case management. And I'm proud to say that we now have 39 case managers that are working constantly with veterans who are enrolled in this program. And the goal is to have 1 per 25, and we average just about 1 to 27 across the network. Some areas being slightly higher, some below that number. Much better than most of the rest of the country, I might add, as well. And there are a number of other programs that Jim will talk about, and others up here. I just want to say, as this tends to focus more on the homeless, because it is one of our greatest initiatives around the country and here in Ohio. And where we seek to continue to put our focus is serving in rural areas. It's a real challenge finding available housing to support folks that are living in the rural in the rural areas. Has been a challenge for us to use our vouchers and find folks that are wanting to work with us. We also have, unfortunately, veterans with sexual offender status that have problems accessing public housing or permanent supporting housing. So these remain a challenge. And veterans with a lifelong or reporting on the sexual offender registry are forbidden to be part of the HUD-VASH program. So again, we have these challenges that we have to continue to meet. So with that, I'm going to turn it over to my colleagues. I'm not sure which order Jim's going to go first. And we want to thank all of you for coming out anytime that we see an opportunity to work with community partners, or we work with the state and other federal entities. We're very willing to entertain additional ideas and suggestions on how we can continue to work with you. So thank you very much for your support and support in the future.